Thank you and good afternoon, everyone. We're here today to discuss emergency medical services, a foundational piece of Alberta's health system. A service every Albertan counts on to be there during their greatest times of need. We know that emergency medical services are facing unprecedented pressures right now. This is due to a wide range of issues, including an unprecedented increase in calls that started over the summer, the pandemic, on top of the pressures we see on the system every winter, the opioid crisis, increased time to transfer patients in emergency because emergency departments are also extremely busy, increase in transfers between hospitals due to COVID-19, staffing challenges across the health system and beyond, with Omicron adding to 2 years of pressure on staff, and finally, global supply chain issues for new ambulances and delays in getting specialized vehicle parts. All types of calls have increased and staff are, quite frankly, exhausted, and some Albertans are frustrated. In particular, I'd like to speak to an incident that took place last week in Airdrie because I think it highlights the strain that our EMS system is facing. While Calgary's own EMS was overloaded, 4 serious, non-life-threatening but urgent 911 calls came in from Airdrie at the same time. Airdrie Fire Department, who are trained as paramedics, provided care on the scene before transporting 2 patients to the Airdrie Urgent Care Clinic. AHS EMS did their best as always to respond to the high call demand. They ensured critical patients received immediate care by reassigning supervisors to frontline and first responder roles, by working with hospital staff to employ quicker transfer of care protocols so that ambulances could get back on the streets, and by pausing interfacility transfers so ambulances could respond to 911 calls. This was an extraordinary situation, a rush of urgent calls on a busy day in the middle of winter at a time when we're likely approaching the peak of pressure on the system from the pandemic. I'm grateful that the patients all received the care they needed, but the reality is the delays that day were too long. We don't ever want to be in a position where we put other emergency services at risk to fill the gaps in our urgent medical care. The staff in EMS and the health system overall have gone above and beyond in responding to the pandemic, and they continue to do that every day. And we're supporting AHS in providing more resources. The EMS base budget is $30 million higher this year than before the pandemic, and they've added more than 200 paramedics and EMTs, an increase of 9%. But the situation last week shows that there are limits on what they can do, and it shows, quite frankly, we need to do more to support them. We've heard from EMS staff, municipalities, contract providers, practitioners, and the public calling for help to ease the pressures on the system, and we are acting on what we heard. We're taking action over the short, medium, and long term to reduce response times and the burdens on staff. In the short and medium term, AHS has developed a comprehensive 10-point plan. Their action plan focuses on immediate, tangible solutions to help create capacity within the EMS system. We'll hear shortly from AHS Chief Paramedic Darren Sandbeck, who will explain the AHS plan. We're also launching the Alberta EMS Provincial Advisory Committee. The committee will be led by co-chairs R.J. Sigurdson, MLA for Highwood, and Tracy Allard, MLA for Grande Prairie. As representatives from smaller communities in both the north and south of the province, MLAs Sigurdson and Allard will provide a strong local perspective in leading the committee's work. Its membership will also include contracted ambulance operators, unions representing paramedics, municipal representatives, and Indigenous community representatives, among others. Having all these voices at the table is important. I've tasked this committee to identify concerns, provide advice, and contribute to EMS service planning as we work to ensure EMS sustainability now and into the future. The committee will provide me with initial recommendations in May, but will make changes and test new solutions that are needed before that time. If there's a need for more funding to put improvements in place, we'll examine those opportunities as they arise. Additionally, we'll be putting out a request for proposals for a third party to conduct an objective review of the EMS dispatch system. We believe that an outside group of experienced health system experts will be able to identify further opportunities to address ongoing pressures and improve effectiveness and efficiencies in how the dispatch system works. Our goal is to strengthen Alberta's province-wide EMS system and support further integration with the broader health system. And of course, to make sure emergency medical services continue to be there for Albertans whenever they are needed. I acknowledge that negotiations are currently underway with the union representing some paramedics and want to emphasize that government will continue to respect the bargaining process while this committee work is being done. In fact, a representative from the Health Sciences Association of Alberta will also serve on the advisory committee. In conclusion, I would like to thank every single EMS worker on the front lines throughout Alberta. You are saving lives every time you head out the door. You are doing extraordinary work under extraordinary circumstances, and it is truly appreciated by those who need your services, their families, Albertans, and this government. Thank you. The measures highlighted in today's announcement will improve our EMS system and continue to help provide the services that Albertans rely upon. So thank you, and I'll now ask Co-Chair MLA R.J. Sigurdson to say a few words about the committee. R.J.
Thank you, Minister. I'm delighted to be here today. I want to thank the Minister for this opportunity to co-chair the new Alberta EMS Provincial Advisory Committee, along with my colleague, Tracy Allard, MLA for Grande Prairie. We are ready to get started on this important work, to find timely solutions to alleviate the stress on EMS staff, and provide assurances to Albertans that when they are in some of the worst moments of their lives, EMS will be there. I've heard Albertans in my constituency express their concern for how busy our healthcare providers have been. Both residents and frontline staff have shared many stories about the strain currently on EMS and paramedics, resulting in wait times and delays. They are worried. I want to remind them and everyone, you should never hesitate to dial 911 when you or a loved one or someone else is experiencing a medical crisis. Our province has highly trained, committed personnel that will always rise to the challenge to help you and your family in the time of need. That's the kind of people they are. The current delays are not a reflection of the ongoing commitment and dedication of our frontline EMS personnel in helping Albertans. The EMS Advisory Committee will support their efforts. We have assembled a group of remarkable people, leaders who genuinely care about EMS staff and every Albertan and the communities that they serve. The committee represents experienced, motivated individuals, including paramedics, their unions, and understanding their participation will respect the contract bargaining that is currently underway. Rural and urban associations, the Firefighters Union, representative from First Nations and Métis communities, AHS, EMS, contracted ambulance operators, and advocates for patients and their families. I'd like to thank all of our representatives for coming to the table to offer their insight, knowledge, and support as we look for immediate and longer-term solutions to assist paramedics and those serving during this unprecedented time. Access to emergency medical services is vital for all Albertans, and the sustained pressures paramedics are facing currently is a concern for all of us. Thank you again to the Minister for your leadership and your concern for Alberta's healthcare providers, who we have relied upon so heavily over the past couple years. This committee's goal is to ensure and improve timely service to Albertans while at the same time supporting the most critical piece of that equation, our EMS staff across all of Alberta. I personally want to thank our paramedics who continue to give their all every day to protect our communities when help is needed most. I will now turn the podium over to my co-chair, MLA Allard, to share a few thoughts about the new committee.
Good afternoon. It's a pleasure to join you this afternoon. Thank you to my co-chair, MLA Sigurdson, for the introduction. And again, good afternoon, everyone. I'm just going to put this down because I'm so tall. I would like to echo the thanks to Minister Copping for this incredible opportunity to make meaningful change in Alberta's healthcare system through this work. I'm honored to be co-chairing this committee and look forward to meeting with members and getting to work on this issue, an issue that touches most Albertans at a critical moment in their lives. Much like my colleague MLA Sigurdson, my constituents have also shared their thoughts and concerns about ambulance wait times and other emergency services, and I remain deeply committed to this task to improve EMS delivery for Alberta communities. Emergency medical services are busy, as the Minister mentioned, and they are getting busier. While there are challenges, I am grateful for the people in EMS who faithfully serve day in and day out, responding to Albertans in their time of need and ultimately saving lives. Paramedics are doing a great job working within the system, and we now have the means to gather people from all sides of the service and to look at how we can make a real difference and what improvements we can make now and in the future. The Alberta EMS Provincial Advisory Committee is an opportunity born out of necessity and a chance to lead the way with innovative ideas. We are committed to listen, to learn, and to work together for great improvement for all Albertans. The best part about this committee is the willingness and ability to pilot changes that make sense while still meeting and formulating recommendations to work towards continuous improvement. MLA Sigurdson, my co-chair, and I will be working with the Minister and AHS to put appropriate solutions into action and as quickly and as safely as possible. This will allow us to determine what things can enhance services while we are still together and can adjust and adapt accordingly. When we have our first meeting, I know that we will have the expertise around the table to inform this change, a solid operational plan, and provide Albertans with a greater confidence in our EMS system. I believe that as we find the right tools, we can make a difference to patients and their families, not in a matter of years, but soon, imminently. I would like to thank all of our partners for their participation in this important work. On behalf of all Albertans, I would also like to give my heartfelt thanks to our paramedics, to our firefighters, to dispatch, and other EMS staff and healthcare providers for your work during this pandemic. Your tireless and selfless efforts to help those who need you most is inspiring. I will now turn the podium over to Darren Sandbeck, Chief Paramedic and Senior Provincial Director of EMS at Alberta Health Services. He's going to speak to you about Alberta Health Services' current and new initiatives to address this EMS situation. Thank you very much. Mr. Sandbeck?
Thank you, Minister Copping and MLAs Allard and Sigurdson. We very much appreciate the government's awareness and action on EMS in Alberta, and we're very much looking forward to working with the advisory committee. Just want to acknowledge that also joining me in the room today is our EMS Senior Medical Director, Dr. Mark McKenzie. We really believe that the more folks that we can get together on these issues, the better the outcomes will be. I also just want to take a moment to recognize that there's been a lot of social media and media attention on the EMS system and our challenges. We truly appreciate that so many people are concerned and want to help with their ideas and advocacy. Sometimes these conversations are difficult, but this is what we need to do to improve and get through challenging times. The advisory panel will help us further engage individuals and groups and create a meaningful dialogue where we can collaboratively address these ongoing issues and pressures. We are here today because the EMS system is under considerable pressure. While we are doing our very best every day to be available for Albertans, demand has increased significantly and is now at historical levels. COVID-19, higher acuity patients, the opioid crisis, and extreme weather-related calls are some of the reasons we are experiencing such high call volume. This is not an Alberta-only challenge. Similar pressures are being felt by all Canadian provinces and ambulance services internationally. We are in frequent communication with other services to share ideas and learnings. Over the last few months, we've been adapting our service delivery model so our EMS employees and Albertans can continue to have confidence in EMS service. Much of this has been going on behind the scenes, so hasn't been visible to most of you, and I appreciate it is helpful for the public to have this information. This is what we're here to share with you today. Alberta Health Services EMS is taking immediate action with a 10-point plan to address the unprecedented pressure on the EMS system. The plan is made up of 10 new initiatives designed to help reduce demands on existing resources, to increase availability of ambulances for Albertan patients who truly need them, and to plan for the future. I appreciate that many of these actions are internal processes and will be unfamiliar to the general public, so I'll do my best to explain what each of these actions is and how it will help. I'm going to talk for a while here as I go through all 10, so please bear with me. EMS has already undertaken several of these 10 initiatives. We are moving to better manage staff fatigue. Known as EMS Hours of Work project, we launched in November of 2001. EMS is adjusting our working hours, shifts, and scheduling at some EMS stations throughout the province to help alleviate fatigue amongst staff. 2, we are now transferring some non-emergency or low-priority calls. These calls are transferred to other referring agencies such as the Poison and Drug Information System, and we're developing processes to transfer calls to HealthLink 811 when appropriate and in consultation with our EMS physicians in dispatch. We have updated our non-injury collision response protocol. EMS is no longer automatically sending an ambulance to a motor vehicle collision where there are no injuries reported. Previously, an ambulance would have been dispatched automatically, and the crew would need to confirm that there were no injuries. These calls are still responded to by our partners in police and fire as appropriate, and EMS will always attend if injuries are subsequently identified. We are continuing to hire paramedics. We're working hard to fill all openings as quickly as we can, and we are in conversations with the college and institutions about expanding these specialized paramedic training programs so that there are more qualified candidates to hire. We are working better to manage non-emergency interfacility transfers. 2 pilot projects underway in Calgary and the North Zone where patients do not need urgent medical care, but are transported from hospitals to appointments or back to care homes and residences by means other than ambulances. In addition to these initiatives already underway, work has started on some additional initiatives. These include the creation of a Calgary Integrated Operations Center, or IOC. This center will mirror an IOC operating in Edmonton, which brings together paramedic leads and zone and hospital staff for improved integration between EMS and the hospital system to improve overall patient flow. We are making adjustments to our emergency communications call evaluation. EMS will be implementing additional dispatching processes provincially, including evaluation by an emergency communication officer to determine if an ambulance from out of area, though it may be closest to a 911 call, is most appropriate to respond. As an example, if an ambulance from Okotoks is in Calgary and has dropped off a patient, it may technically be the closest ambulance to a Calgary call, but it actually may be more appropriate to route that ambulance back to its home community of Okotoks to provide coverage to that community and send the next closest Calgary ambulance to that 911 call. We will have the ability to preempt and divert ambulances. I appreciate that's a little bit jargony. I'll try to explain. This will allow EMS to divert ambulances to higher priority calls when appropriate. This changes the way that ambulances are assigned primarily in Calgary and Edmonton and will assist with keeping resources in our suburban and rural communities. At the request of Alberta Health, EMS is instituting a provincial service plan directive, which will look at current EMS services and create a 5 to 10 year plan. And finally, we're working on something we call the hub and spoke interfacility transfer pilot. This new concept would manage the bulk of interfacility transfers in the Red Deer corridor with dedicated transfer units, freeing up ambulances to provide community coverage and to handle primarily emergency calls. So some people may wonder why we waited until just now to move on these ideas. The truth is that we haven't waited at all. Many of these actions have been underway behind the scenes over the last number of months. We've been focused on making these improvements and perhaps not as diligent as we should have been on talking about them. The 10-step plan is, however, in addition to actions that have been taken over the past several months to increase EMS capacity and respond to demand. These include deploying supervisors to calls, delaying some non-urgent transfers, and working closely with our partners in emergency departments to ensure that we have timely flow through our emergency departments and return ambulances to the street. We have also worked to bring on additional staff, including 30 full-time and 70 temporary full-time paramedic positions across the province. We continue to respond quickly to life-threatening calls and deliver a high standard of care. That quality service and care is what we strive to provide every day. We anticipate this 10-point plan will help us even better serve all Albertans. We are tired. We are all tired, Albertans and EMS staff alike. We recognize the toll that the last 2 years has taken on people. And again, I can only say thank you and thank you for all of us, from all of us, for all of you being in this together. I'd like to wrap up by saying thank you to Albertans who continue to be our focus, and to our EMS staff for whom the focus on Albertans has never wavered. And as the minister spoke in his comments about a situation in Airdrie late last week, I'd like to offer my sincere apologies to those families in those circumstances, and what we have laid out today will help us do better. Thank you.
Thanks for that, Chief Sandbeck. Just a reminder to reporters on the line, we have 5 different speakers available to take questions. That's 4 speakers plus Dr. Mark McKenzie, the EMS Medical Director. So I'll ask you to, as always, keep questions short, 1 question, 1 follow-up. Operator, can we have the first call, please?
Thank you. Yes, the first question is from Andrienne Williams, CBC French.
Hi, my question is for Minister Copping. It's about the vaccination of children between the age 5 and 11. I would like to know what is the province doing to increase the number of vaccinated children, given the fact that Alberta has the lowest rate amongst all Canadian provinces.
Well, thanks so much for the question. As you know, we are sitting at roughly 42% of children in that age range vaccinated right now. We have sites across the province that are opened up, and they're opened up from 8 a.m. to 10 p.m. Really to be able to enable parents to come with their children to get vaccinated. We heard from parents that they actually want to be with their kids for vaccinations, which is why we established it that way. But I appreciate that we're continuing to provide information to parents to get kids vaccinated. We have established a vaccine hesitancy committee, and they are looking at this issue, and I'm looking forward to any recommendations that they may have to be able to help improve vaccination for this particular group.
Can I have a follow-up?
Go ahead.
Okay. So Alberta is Alberta has the lowest percentage of vaccinated children of that age group. Why is that? What are other provinces doing that Alberta isn't doing? How are you planning on reaching out to parents to give them the information they need to make their decisions?
Yeah, so we already have reached out to parents, and we will continue to do so. Dr. Hinshaw wrote a letter to all parents, again urging parents to review all the information, provided all the information, and reiterated the recommendation not only from the National Advisory Committee on Immunization, but the Alberta Advisory Committee that kids should get the shot. And we urge all parents to look at the information and to do so. Our approach is not that dissimilar from other provinces in terms of rolling out the vaccines. But again, I'm looking forward to recommendations from the Vaccine Hesitancy Committee. If they have any further suggestions that they can make, that we can actually increase the coverage for that 5 to 11 age group.
Thanks, Minister. Operator, we'll take the next call.
Thank you. Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. I'm wondering if you guys can explain a little bit more about the low priority calls, how you plan to bump those, either put them off or transfer them to other agencies. What other agencies would be involved? What other type of vehicle would be involved? And how do you avoid exacerbating another problem? Like if you hold off on transferring someone who needs to go back to a long-term care home from the hospital, that person ends up in the hospital longer, which creates the backlog that way. How do you pull all that together?
Yeah. So I'll start the answers initially. Part of the 10-point plan, the approach is how do we actually reduce the volume coming into the system, and then how do we actually when the system when it gets to the hospitals, how do we manage that? And then the purpose of the committee was bringing in all stakeholders to be able to look at the processes from stem to stern to how do we improve that. But in terms of your specific question, I will defer.
Thanks for the question. It's Dr. Mark McKenzie. I'm the Senior Medical Director for EMS. Minister and MLAs, I'm looking forward to participating on the advisory committee with you. And thank you all also very much for your messages of recognition for the hard work that our emergency communication officers at dispatch, our paramedics, our air ambulance providers, and all our frontline workers in EMS are doing. Thank you for that. Thanks for the question about managing low-priority events at the level of dispatch. Although there are many contributors to the overall EMS problem, it really comes down to at times having more calls come in than we have resources to be able to manage all those calls. There's a medical priority dispatch system which prioritizes the calls coming in, and we want to make sure that we're responding first and foremost to those patients who have life or limb-threatening conditions. So while low-priority callers may get may not immediately get an ambulance, we do have processes to make sure that their healthcare needs are being met, which I think is the crux of your question. So they're not just being held or transferred, they're receiving callbacks from physicians at dispatch, physicians in dispatch just being another great example of our EMS being integrated into greater health. And essentially the physicians will make sure that the patient waiting for an ambulance is the safe thing to do, but we can also act as patient navigators and sometimes find alternative means for that patient to have their healthcare needs met.
Thanks for that. Carrie, follow-up?
Yeah, thank you. Along the way, you guys had briefly mentioned an hours of work project, that was part of the 10-point plan. What is that?
I'm going to hand that question off to Chief Paramedic Sandbeck. Darren.
Thank you for that question. What you're referring to as hours of work, or we're now calling fatigue management, is a process that we undertook over the last 18 months to look at all EMS stations across the province and where they become at risk for fatigue. So when they're working too many hours in a row, and then they need to have time off due to fatigue. So we did an analysis across the province, identified a number of stations across the province where additional staff may be required, the shift may need to be adjusted slightly, or in some cases, additional ambulances may need to be added. We built that into a priority list to address those and have begun to address those as of November of last year. We will continue through phase 1 of that project into this spring, and we'll also concurrently implement phase 2 of that, where we'll continue to address those high-level system pressures, those higher areas at risk of high risk of fatigue. We will invest just over $24 million over the next 2 years to undertake that work and to make those investments for fatigue management.
Thanks, Chief Sandbeck. So we'll take the next caller, please.
Thank you. Catherine Krakowski, Alberta Today.
Thanks for taking my question. So some of the measures that are already in place, such as not automatically dispatching an ambulance to a collision, or the changes to inter-facility transfers, are these intended to be permanent changes, or is this just until pressure subsides?
Thank you for that. These are intended to be permanent changes. I would share with you an example, particularly around the not responding to non-injury motor vehicle collisions. So it's not uncommon for us in Alberta, as we all know, to have freezing rain at various times throughout the year. Those events, those days when we have those events, especially in our large metro centers, will create literally hundreds of minor motor vehicle collisions. The vast majority of those motor vehicle collisions do not result in any injuries. Previously, we would have dedicated a resource to check out those motor vehicle collisions, and as of early December, we stopped doing that. So I think you can appreciate what that does to free up resources for the rest of the system when our emergency communication officers are confirming that there's no injuries on the scene and that there is no need for EMS to respond.
Thanks for that, Chief Sandbeck. Catherine?
Yeah, and to follow up, earlier today, the NDP opposition called for daily reporting of red alerts, as well as a restoration of the Hilo pilot project that shut down in October 2019. Wondering if you're looking at bringing either of those recommendations in as part of the review.
Thanks for that. I have not seen that news release to this point. I do need to emphasize that the red alert reporting is currently only done in Calgary and Edmonton, although it has grown across the province where it is not necessarily applicable. We measure red alerts in Calgary and Edmonton only, and we'll be working with the advisory committee on those reports going forward as part of their work, I'm sure. Related to HELO, HELO was a program that we ran in Calgary and Edmonton Metro hospitals and in the Red Deer Regional Hospital on a 9-month trial back in early 2019. It was an initiative that we tried to improve emergency department offload delays that our EMS crews experience. We did have early success with it, although that success was not sustained. And we made a decision that it was better to use our resources that were doing the HELO work in other parts of the EMS system. I fully anticipate that the advisory committee that the minister announced today will also be taking a look at the challenge that emergency department offloads that we face with emergency department offloads.
I think the minister's going to supplement.
Yep. No, thank you for that. And just to add, one of the reasons why we pulled together the advisory committee and its stakeholders from across the entire spectrum that touch on EMS is that they can look at the overall processes. And one of the conversations that they're going to have as well is how do we measure success? We already have a number of metrics in place. We have also asked the Health Quality Council of Alberta to develop additional metrics as well. So I fully expect this will be one of the conversations in terms of what are the metrics that the committee will be having, and then looking at how do we address these issues, particularly in regards to handoff at the hospitals. We know that our target is 90 minutes, and we're exceeding that target in a number of locations. What's worked in the past, and quite frankly, what hasn't worked? Why hasn't it worked? And then can we address that and be able to put in another pilot that may work so we can address this issue?
Thanks, Minister. We'll go to the next caller.
Jason Herring, Post Media.
Hi there. I suppose this question is for either Minister Copping or Chief Paramedic Sandbeck. We've known for a long time the pressures have been increasing on the EMS system, and this is becoming a more and more untenable situation. Wondering why we haven't heard anything from the province on measures to mitigate this before now, and as well how these changes are meant to help the situation immediately.
So I'll start, and I'll allow Chief Sandbeck to continue. So, and I mentioned this actually last fall in the House, that the system has been under strain. There's been a 30% increase in calls since the summertime. EMS and the government have acted. We've added additional resources into the system to be able to address this. But just so you know that some of the challenges that we're dealing with have been around for quite some time. Not only it's been exacerbated given some of the items that I mentioned and given COVID, particularly over the last 6 months, but some of these challenges have been around for years. EMS has responded with, AHS in terms of adding resources to the system, but we are announcing this right now because we know some of the items have been in play for a number of months, but we also need to look a medium-term and a long-term view, which is why I'm really excited about the work that this committee will do to address these issues and make sure we have a sustainable system for the future. Chief Sandbeck?
Thank you, Minister. I would just add that, as I spoke about in my comments, we have been working on these initiatives for months. Some of these take some time to get into place and require changes to our workflow processes that we undertake in our communication centers as well as in operations. And just to supplement the Minister's comment on the longer-term plan, and you heard me speak of the provincial service plan work that's underway that has started. And we're very much looking forward to how we take the work of the advisory committee and blend that now into the longer term planning work that we'll be doing under the provincial service plan development. So.
Thanks for that, Chief Sandbeck. Jason, follow-up?
Yeah, for sure. This one for Minister Copping. Last week, the HSAA put out a call to government to help alleviate pressures on the EMS system. They raised concerns about staff being unable to access appropriate time off or PPE. I received a statement from your office at the time where Alberta Health called this 100% empty union politics. I guess I'm wondering now how you square that with this increased urgency to fix the system.
No, I appreciate the question. You know, our focus is on managing the challenges with the system. We need all stakeholders at the table. We've invited HSAA to be at the table, and they have agreed to be able to do that. So I'm thankful for them to be part of the solution. And you know, we need to look end to end, have all the stakeholders there, look at the process from tip to tail to ensure that we can be as efficient as possible. And then if we need more resources, that's something that we're going to look at. So again, you know, I'm looking forward to the committee coming back to us, and if they have some, you know, immediate suggestions that we can implement on a pilot basis, we'll do that. And I'm very pleased that the HSAA and, you know, others representing paramedics are here and going to be involved in helping us solve the problem.
Thanks, Minister. I think we've got time for two more questions, so we'll take the second last one.
Thank you. Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. This is for Minister Copping. You spoke a little bit about expanding internal metrics, and I understand how that can be helpful for AHS, but will you be making changes to public reporting on the status of emergency medical response? As it stands right now, we need to FOIP status on red alerts and similar statistics. So will you release those publicly, and if not, why not?
No, thanks for the question. You know, that's some of the advice that we'll be looking from the committee to provide. You know, the Red Alert is an internal management tool. If you go on the website right now, you can actually see the response times for different regions, and both at what are the targets, what are the averages, what's at the 90th percentile. As I indicated earlier, we have asked the HQCA, the Health Quality Council of Alberta, to develop some metrics, and I look forward to hearing from the committee in terms of not only how are we going to measure success, but also from a public standpoint, what in addition to the metrics we already have out there, should we ensure that people have access to?
Thanks, Minister. Lisa, follow-up.
Thanks. Yeah, so just to clarify, the answer on that question is no. I also have a question for Mr. Sandbeck. I'm wondering, you mentioned some of the initiatives that you're working on have been underway for several months. I'm wondering, when exactly did they begin, and what kind of measurable improvements have you seen from them? Can you point to any statistics on that?
Yeah, if I can just, before Chief Sandbeck comes over, just the comment is, the answer is, will we look at providing more public data? Likely, yes. That work is underway, and I'm looking forward for the committee to report back. Chief Sandbeck.
Sorry, could I just get the question again, please?
Sorry, yeah, you spoke about several initiatives that have been underway for the past number of months. I'm wondering when exactly did they get rolled out, and if you've seen any kind of measurable improvements because of those initiatives. So
a number of the initiatives that we have put in place have all been relatively recently, as I spoke about the stop responding to non-injury motor vehicle collisions. That came into place in early December. Some of the other pieces that we're still working on will come into place over the next weeks into early February. And as this essentially as this package comes together is when we'll really be able to measure what impact those are having on the system, and if we're able to create additional capacity within the system by those initiatives.
Thanks, Chief Sandbeck. So we'll take our final caller right now, please.
Thank you. Alicia Corbella, Post Media.
Thank you. Good afternoon. My first question is for Darren Sandbeck, Chief Paramedic, and Dr. Mark McKenzie. It has to do, actually, it's kind of serendipitous. I received an email from a physician who talked about emergency rooms and the issue of paramedics getting stuck in emergency rooms. And his suggestion was that maybe the best way to deal with that, seeing as there's two paramedics and only one patient per car, that each paramedic car would handle the next, like the first car would handle two cars worth of patients, so the second one, and so that only one car would be there at a time for every two patients. And I thought, gee, that's a really smart idea. I don't know if that's something that is already happening, or if it's not already happening, why not? And perhaps there's a legal requirement, or I don't know. So I'd like somebody to address that, or both of you to address that if possible.
Thank you for that question. I can address that directly. We currently operate a protocol called patient consolidation, where what you described is exactly what happens, where EMS crews, a crew of two, will take over patient care for a number of patients, 2 to 3 patients at a time. And then when we get into times of really increased demand, like we saw in the Calgary zone last Thursday, those numbers will increase where it's safe to do so, to consolidate additional patients under EMS crews. So we currently do that practice today. It happens very regularly.
Thanks, Chief Sandbeck. Alicia, follow-up?
Yeah, follow-up is when the province changed the dispatch system to a province-wide dispatch system, I'm wondering if that caused issues and how severely, and is this part of the problem, was the moving away from the local dispatch to the more province-wide one?
The minister's going to speak first, and I'll supplement.
Sandbeck.
The minister's going to respond first, and I'll supplement.
So thanks for the question. These are two separate issues. In regards to the, as you know, dispatch was consolidated with the exception of 4 municipalities, which was done last year. Now, don't get me wrong, there were some issues in terms of implementation. A working committee was established to address those issues. And in addition to that, as part of the announcement today, and this was something that was requested by municipalities to do a independent review of the overall dispatch system. So we're going to do an RFP and have someone deal with that. But just so we're clear that this particular issue, that like the dispatch integration, it was done for all areas of the province with the exception of 4 municipalities previously. And there were some transition issues, but we continue to work through that. But that's a very small part of the overall provision of EMS services. And I asked Chief Sandbeck to comment further on that.
Forgot my hand wash that time. Thanks. Nothing really supplement that with other than just emphasize that, we have seen a 30% increase in call volume that began in about February of last year. It is not related to dispatch consolidation. We would have had this increase in call volume regardless of if we would have done dispatch consolidation or not. Frankly, I believe that the increased demand that we're seeing on the system and the pressure that we have is easier for us to manage those resources under a consolidated dispatch environment, but the two are not related.
Thanks, Chief Sandbeck. We'll wrap up there. Reminder to reporters, if we didn't catch you, you can always follow up directly with Minister Copping's office, myself, or AHS. Thanks, everyone.